You know, the county partnership or relationship that we have with Partners is fairly new. The things that attracted us to Partners, though, is that they seem to have the same culture that we do. You know, we define Rutherford County as small town friendly, and we are doing everything we can in relations to those things that we can influence through our governance to improve the quality of lives of the citizens that live in our county. And Partners has that same culture. So it certainly seems like that we had a great opportunity to be part of the Partners organization or the coverage within their catchment area due to that commonality in our cultures.
I think Partners, what makes them unique is they're always at the table. Every board, every commission, they have a seat at the table, and they're really supportive of the work of the community. For our department, they're really interested in the determinants of health. They look to see how they can help to make a positive benefit and to support the work that we're doing, and in turn look to us to provide resources and referrals to them as well. Substance abuse has been something that's been on our radar as a community and something that we wanted to positively address. And Partners, because they knew the community so well, has been very actively engaged with local leaders, both at the county level, all the way down to local leaders within the faith community, across neighborhoods, and just across the county in general. I can think back to a couple years ago, Partners was able to pull the governor of North Carolina in order to make a positive statement about the work being done to address opioids. So based on the governor coming to the community, I think that went a long way in bringing positive attention to the work that the community is doing to address the opioid issue.
The one thing that the county really appreciated in Partners is once we started looking at realigning to Partners as our catchment area, we were really impressed and appreciated that we had such good communications, not only with the staff and the teams that are part of that realignment process, but also all the way to the top to the board members, and specifically with Rhett Melton as a director. That's not something that's common in these type of larger organizations, so that certainly impressed us. The more we became invested in moving forward to realign to Partners, the more we saw that. It became more apparent that they certainly have a very intact and reputable presence all across the state of North Carolina. All the way from DHHS down to the other catchment areas. But specifically for us, it's been more of our neighbors, Burke County, Cleveland County, and Lincoln, and certainly even through the channels that are not part of the administration within the county government. You know, we were hearing a lot of positive feedback through our Department of Social Services and health departments about the level of commitment and service to the communities that was coming out of Partners. I think another critical component was seeing that we would have some level of representation within the Partners organization, which we didn't have previously with the prior LME-MCO. But also too, the counties are required to provide a certain level of maintenance of efforts for funding for services. The difference in Partners and the prior LME-MCO is that it's a partnership with Partners. The opportunity to work with the LME-MCO to decide where those funds were going to go to directly serve citizens in Rutherford County was important to us, and Partners recognized that.
Partners' name in and of itself is what they mean to this community. They're a partner for us within the Department of Health and Human Services, but they're also a partner for each individual who is in need and in times of crisis. So I think Partners' name reflects exactly who they are and what they mean to this community. They're a partner.